The following was recorded in front of a live studio audience at the Studio 21 Podcast Cafe. This is the United Podcast Network.
The following program is closed captioned for the thinking impaired.
By tomorrow, I will rule the world!
You think he's gone? He's not gone. That's the whole point. He's never gone.
Is this some radical new therapy?
You see?
Well, I must have not been paying attention when you were just talking to me.
That's the extent of the dancing that I do. That's literally it. Arms and shoulders, that's all.
There must have been something in all of that nothing that wasn't quite so easy to see. And I must have missed something when you were just talking to me. I must have not been paying attention when you were busy slamming the door. I guess the things that pass for affection.
Facebook worked perfectly until we went live. Perfectly till we went live. And now suddenly not so much.
In all of that nothing that dropped me like a stone to the floor. And I must have missed something when you were just slamming the door.
Oh, I don't mind.
Just a little, it's driving me out of my mind. Oh, could you spare me the riddle and have
By the way, for those of you who like Melvin Taylor, the guy that does the open of this show, he's been going live lately. If you go on Melvin Taylor on Facebook, he's been going live like from his basement and doing a lot of his old songs like this one. And it's been pretty good. It's been a lot of fun. I've been really enjoying it.
Since he made this song for you, does he have to pay you to play his own song?
Yeah, he should pay me a royalty. All the free stuff he's getting out of it. I'll wrap you up. Yeah. It's just a nightmare. All of Facebook is just a nightmare, no matter what you do. What do we got? 10 people. We'll get that up to a couple thousand by tomorrow. No, last week's show when we had Richard Lawrence here, civil rights leader Richard Lawrence, I thought we'd have like 5 viewers. We were up over 2,000 on the video, so that usually means that the audio is up around 5,000 because we usually do like 250% on the audio downloads than we do for the video. So a lot of people watch the show live on Facebook, live on YouTube. They watch the show, but you can download the show on audio, and a lot of people are doing that a lot more. I didn't know, like the first 6 or 8 months I was doing this show, when we started the show, I knew we were doing audio, and I knew it was going out on the audio stuff, but I didn't pay any more attention to it. Like I was just focused on the visual of the Facebook part of the show. Until I started getting the numbers. I think I was doing the show for like 6 months before I started getting actual numbers of like viewers. And I started getting these numbers, and I'm like, I called Dave. I'm like, this can't be right. 10,000 views in a month? Like, I don't think that's right. Is that right? And he's like, no, that's just your audio. Your Facebook was like 3,000, and your audio was like 10,000. I'm like, are you kidding? What audio? What do you mean audio? And then it hit me. Oh yeah, we're doing the audio stuff. So those of you who like to watch the show on Facebook, we love having you. If you have any questions, we got Lisa Williams from AFC Urgent Care here today. We're going to be talking about the vaccine. We're going to be talking about COVID. We're going to be talking about all kinds of health stuff with Lisa Williams with AFC Urgent Care. And we love Lisa Williams because, you know, she's one of these business owners in the community, like the Fitzgeralds at Man Orchards and Don Smerglio over at Borelli's Deli and a whole host of other people. There's like really like 8 or 9 people in the Merrimack Valley who own businesses and don't just focus on their business. They go out into the community and they help. When we have TMF family dinner for the homeless, Harrow's Pies. I've never met the people at Harrow's Pies. Harrow's Pies saw me post that we needed food for the homeless for TMF one Wednesday night, and they showed up with a truck with 50 pies. And I don't mean little pies. I mean like 50 pies, like this big. And when we were done, there was like, I don't know, like 8 or 10 pies left over. So we drove around to all the tent cities in Lawrence. Pies? What's that?
Like fruit pies?
No, like chicken pies.
so nice.
Right?
Yeah.
And so Nancy and Chris and myself and our friend Bob drove around to all the little tent cities with all the extras and just gave it to them. And you have no idea how happy they were that like somebody was giving, and it was still hot by the time we got there too. Right? So we want to thank people like Lisa Williams and people like the owners of Harrow's Pie. They don't even know who they are, but they follow me on Facebook. We should get them to advertise too. But they follow us on Facebook, and they've been following the homeless stuff. And they just said, oh, look, there's a need here. We want to help. And so I always like to have those people on the show because you should be patronizing those businesses that are helping the community. And one of them is Lisa Williams from AFC Urgent Care. And we'll talk about our sponsors in a few minutes. But we wanted Lisa here because there's so much going on with this COVID vaccine, with the new strain of COVID. Oh, people are still trying to get tested. And so I thought the perfect person to have here for this would be our friend Lisa Williams from AFC Urgent Care.
Happy to be here.
So we love having you. I love having you here.
I love to be here.
Not only for all the reasons that I said, but also she's a really good person. And when she gives her word, she keeps her word. And I like that about people. I like when people give their word and they keep their word, even when it's tough. Even when people are pulling you in different directions, you give your word, you keep your word. And to me, that's 100%. Like I'll always go 110% for somebody who keeps their word. So I appreciate that, Lisa. So with all this going on, we've got a new strain that they're talking about, a new strain of COVID. We've got the vaccines that have been rolled out, although I'm not too sure very well, at least here in Massachusetts. And we've got people still trying to be tested, right? You have people still want to be tested. So you must be you must be inundated at AFC Urgent Care because now you're not just doing testing, but you have to do vaccines, you have to do all this other stuff. Talk about that.
So we're actually seeing a lot of sick patients too. So half the center right now is COVID, and the other half of the center is actually ill and injury. So we don't have our little testing booths outside. We're actually bringing everybody into the center. We have a special now air filtration system in all the rooms, killing, of course, all the COVID.
That must have cost a pretty penny.
Let's not go there.
Okay. All right. Well, I only brought that up because I think hopefully some of that's reimbursable through all this. No, it's not. All this COVID stuff.
That's not real. But what the patients were used to all being, of course, tested outside. And now they're coming into the center, and now they're, of course, worried about whether or not there's COVID in the center. But now we, of course, invested in these special lights that are killing the COVID if it actually is in the center. Of course, we have special protocols for the ill and injured and the COVID patients. But the big thing is, and I think a lot of the confusion in the community is what is actually covered for patients. So if you are traveling or if you just want to come in just to get tested, that is not covered under insurance. So
if you want to just come in for testing,
I just want to come in because I just want to get tested because I just have symptoms, or I'm going to go see grandma.
I thought at one point all of that was covered.
It was.
Now suddenly it's not?
It's not. So we had a contract under the state called Stop the Spread, and all of the in Methuen, and all of the testing was covered. And so if you just wanted to walk in the door for any reason whatsoever, testing was free. So now it's not. As of November 31st, the state stopped that contract, and now when you come in, you have to have symptoms or you have to be exposed in order to run it through insurance. And insurance is covering if you've been exposed or if you have symptoms. But if you come in and say, I'm going on vacation or I just want to get tested for any reason, there is a cost associated to that.
So the key is if you're going to go get tested for COVID, you have to tell them you've been exposed, that you know someone that has
I'm not saying that.
You're not, but I am. But I am. Because I haven't been tested.
Right.
I haven't gotten the vaccine. Right. I don't really think I'm going to get the vaccine, at least not in the first couple of rounds. I want to see if everybody else dies first.
Right.
But at some point I probably will. But if I need to go get tested, if for some reason I feel like I need to go get tested, I'm going to have to go in and say, oh yeah, I've been exposed. I know someone that has it.
Well, I mean, we're exposed almost every day, right? You're exposed at the grocery store. You're exposed if you go out to dinner. You're exposed just being outside. But I understand if patients come in and they haven't been asked to pay previously and they commit now, they're of course getting very upset. What we're also asking people to do is register online, just going directly to the website and register. We actually can see now an extra 50 patients a day in each location.
Oh, wow.
Yeah. Every morning we're actually loading more visits into the system. We can actually see a lot of patients.
How many vaccines do you do a day?
So actually, we don't have the vaccines in the center. We do the testing in the center, but the vaccines are that's completely separate. So with the vaccines, which I'll talk about that later, we'll focus right now on the testing.
That's your show.
We can actually treat up to about 130, 150 patients in each location every day. Now, the vaccine in Massachusetts, that's been a slow process. Yeah. If you want to talk about the
I got an email from Dave.
We can talk about that the whole rest of the show. But if anybody has any questions about the cost of testing or whatever, I think everybody in the Merrimack Valley has my cell phone and my email address. Feel free to
Or we could just talk about it on the show so they don't have to call you. Like, that's the whole point of being here. So less people call you on the phone.
Well, if anybody has any questions about it.
Sure. We'll take questions from people. So you must be, with all of this going on, there must be people who think that you're doing vaccines at AFC and they're coming in looking for a vaccine.
So nobody has actually come in looking for a vaccine, but people do have questions, of course, about the vaccine.
All right. Well, thanks for coming. Good night. That's the end of the Paying Attention podcast. Thanks for coming. Our sponsors are...
You already have a question.
Oh, we do? Okay, give us the question because I'm not on that page.
How much is it?
How much is the testing?
That was your first question.
So so we actually have 4 different types of tests. So we have the rapid molecular test, and that's $150. Yep.
It's a lot of money.
I know it is. That test is very expensive. The Abbott ID Now rapid molecular test is very expensive.
Wow. And so they come in and they get tested. How long before they find out whether they've got it or not?
They wait right there.
Oh, right there. So it used to be like 8 weeks, and then it was like 4 weeks, and then it was like within 48 hours, and now you just wait.
Yeah.
So that's that's great progress for at least the science of doing the testing and with the vaccines. So have you seen the positive rates of COVID going up in the Merrimack Valley?
So it did kind of spike around like in between Thanksgiving and Christmas, and now it's going down. So we have that test. And we also have an antigen test, the Sophia test, and that is around the same price range. And that is also, you find out immediately. We have a PCR test, which is a send out to LabCorp, and that is, you can actually run that through your insurance, and that is anywhere between 2 to 3 days. And people call me and they get really mad because they want their test immediately, but I can't speed up LabCorp. As much as I want to speed up LabCorp, I can't. And if we have another PCR test, and this actually goes to the Broad Institute at MIT. You actually can pay cash for this because Broad does not take cash, does not take insurance, and you get the results there anywhere between 12 and 48 hours. So let's say I do like a mass testing like we did in Haverhill and did in North Andover, or if we go into a municipality or a company, and we're testing like a lot of people at a time, we can do almost like 400 people a day, that we usually use that PCR test. That's a great test.
What does PCR stand for?
I forget.
Oh, that's okay. Sorry.
I'm sorry.
I'm trying to stretch the show.
Sorry. I should know this.
So you, as a small business, you have spent a lot of money trying
on testing.
well, but not just that, but trying to stay open, right?
Yep.
You had the ventilator stuff that you put in and all that. I thought that.
And the boxes, do you see like our little boxes that are outside? Right. Oh, those are horrible.
But for some reason, I hated those. I thought that the government reimbursed businesses that were spending money on COVID-related stuff. No.
So they did. That's complicated.
Yeah.
That's a whole other show.
All right.
Because we were closed.
We got a whole hour.
We were closed for a while in North Andover.
PCR stands for
I forget.
polymerase chain reaction.
Okay. Sorry, I asked. Very good. Sherry Johnson asks. Sherry Johnson asks.
Hey, Sherry.
Do you know Sherry?
I don't.
Okay,
But hi,
all
Sherry.
right, very good.
Yeah.
She asks, which test is more effective? We hear Moderna, we hear Pfizer, we hear all these other things. There's all kinds of different vaccines.
Yep.
All kinds of different tests. Which have you found are most effective?
Oh my God, the data. So you could really light up a cigarette right now.
Oh my God! Every woman in my life,
God.
every woman in my life, I have to hear about it. None of my male friends give me a hard time about smoking. None. I've never had one male friend say,
I'm sitting next to you, though.
All right. Okay. Very good. Except for Richard. Last week, Richard did say, I have to admit, Richard. And what did I tell him? I said, every woman in my life says the same thing. He said, that's sexist.
Okay.
I'm like, no, that's true. Every woman in my life gives me a hard time about my smoking, but almost none of my, anyways, male friends.
Okay.
Yes, dear.
So they say the PCR is the gold standard, right? And that is, 98%. They said 98%, 99%. And the rapid tests, they say, are, 94, 95%. However, with the rapid tests, you kind of have to test within a certain time frame.
Mm-hmm.
And I'll say this for the record, no test is 100% accurate.
Right. I mean, there's nothing that's 100%, right?
It really isn't.
So you're always going to have issues.
But right now we have different tests there because I think I like to use the provider's discretion on what test to choose.
What they want to use.
Yeah.
Yeah. So we have another question. It says, please tell me if they know any long-term problems with the vaccines. Now, I have a friend that took the vaccine I was talking to last night. He said he'd had COVID.
Mm-hmm.
He got over it. He took the vaccine about a week ago. He said it was worse than the COVID. For like 24 hours, he felt worse than when he actually had the COVID.
There are some side effects, of course, with the vaccine. I think with any vaccine. I think with anything, you have to look at long-term data. We don't have a lot of long-term data right now. I'm going to get the vaccine.
You haven't had it yet?
I
would think somebody in your position would have been like first in line.
So I didn't get it because we got doses, and of course I'm not a provider, right? I'm not really technically a healthcare provider.
You're not seeing patients.
I'm not seeing patients, all right? Like if I die, who cares?
I would care.
I know you would care.
It would make me very sad.
My kids would care.
Yeah.
But that's...
Great. By the way, beautiful kids. I've been watching, you've been posting pictures of your kids.
Yeah.
And I actually have something for you. I found a Alabama Roll Tide shirt.
Did you really?
Yesterday, and I saw it, and I said, if I remember, I got to bring this to the show tomorrow because Lisa's coming on. I'm a little partial to Auburn myself. I'm not a big Alabama fan.
Stop it.
Always rooting for Auburn, War Eagle. But beautiful kids. They seem really smart. And I've met your son. Yeah. And he's delightful. He's come to the office a couple of times, and we had a couple.
You had a lot of smoking that day.
Yeah,
he's like, Tom smokes a lot of cigarettes.
I am trying to cut down.
I know.
To cut down.
So back to the side effects. Some people do have a reaction. My daughter actually got it. She's another daughter of mine. She's actually a nurse. She had some soreness in her arm.
Yeah, so it goes from maybe some soreness in your arm to getting really sick.
Yeah.
And we still don't know, why people are reacting so differently to this because there's no data. This is the first time it's ever happened, right? So now,
but it was tested on, thousands and thousands of people.
Yeah.
And at the end of the day, they weren't going to allow it to come to market if it was going to, harm people.
Yeah. I'm not too sure. I'm not too sure about that. Okay. I'm a little more skeptical about those things.
I am very excited to be part of helping to vaccinate the community.
Right.
If we apply to be part of that process, and we're waiting on our vaccines to help that process. But it's going to be, I think, a little longer than anticipated.
So there's a new strain now that they're talking about. Now with the vaccine, you have to get it twice, right? You come in, you get it once.
Yep.
And then how long before you have to get the next one? Before you get the booster? So you go in, you get the vaccine. Do you have to pay both times?
No, so the government is paying for it.
Oh, the government's paying for the full vaccine,
Yep.
just not the testing. So you go in, you get the testing, and then a month later you go in and you get the booster.
Yep.
Is there a way to test to see if it worked? Because we know sometimes it doesn't.
So the first time you come in, you have a 50% chance of actually getting COVID, during that 30-day window.
Say that again?
It's 50% effective.
I see. So it cuts down your chances 50% when
Yep.
you get the first one. Then you get the next one, you should be okay.
Yeah.
Right? But with this new strain now, they're talking about maybe doing an additional booster on that one, or no?
Yeah, I mean, I think we're going to have to wait to see how things go.
Yeah.
I mean, I'm not a scientist, right? And I think everything in healthcare is fluid and it's changing. And what we think what's going to happen might change. As you know, six months from now, a year from now,
Right.
we're going to have to wait to see what the data says.
How has your business changed from a business perspective, from a business model? How has your business changed from before COVID to now? I would imagine it would be like 360 degrees,
It's
right?
changed so much.
Yeah.
Just even the patients that we saw, we used to see a ton of injuries. We used to really augment primary care. I remember being in the office and helping patients find a primary care doctor and sending a lot of referrals to specialists and really helping with that continuity of care, getting a lot of referrals from the pediatric office. And now I think still a lot of patients are scared to go to the doctor, which is so unfortunate.
Yeah, I don't go to the doctor.
Yeah, I know.
In fact, my doctor left the doctor's group that I was in.
Yeah.
And I got a letter saying you have to find a new primary care physician. That was like 2 years ago.
Yeah, my PCP actually left as well.
And that was 2 years ago. And I haven't been back. Now I have to go to a specialist.
Yeah.
And in order to go to my specialist, I have to now like go back to Kronos and find a primary doctor that I can then go see, pay them to see them, to get the referral to go back to my specialist to do all my specialist stuff. But I'm very susceptible to this disease. I have an autoimmune disease called ankylosing spondylitis. We don't talk about it much, but it's an autoimmune disease, so I'm much more susceptible to this virus than most people. I'm in that category of people who are at very high risk. And I keep going back to this and knock on wood, but I mean, I don't want to jinx it, but I didn't stop anything during COVID. Like when COVID hit in March and everything shut down, I kept coming and doing my show. We never stopped publishing the paper. We continued delivering the paper. I continued going out into the community, and I haven't gotten it yet. Again, knock on wood. And I feel so bad for some of these people that they hid in their house for 6 months and then they went to the store one day and they got it like right away.
Right.
Are we still supposed to take all of like these extra wiping down precautions and everything, or do we now know that like it's not really easily transmissible that way?
I mean,
I don't know what the science says anymore because it changes every day.
It's like I said, it's very fluid. It's
Right.
changing. I mean, now, of course, yesterday we were told that all kids need to go back to school, which I thought from the beginning, but whatever. That's just my opinion.
Me too.
Whatever. Yeah, I mean, I think cleaning things on a regular basis is really important, and washing your hands on a regular basis.
Yeah,
is
I
really
never do any of
important.
that.
I mean, that is. Did you see the cartoon from the beginning? Meet Bob. Bob is not dirty. Bob is clean.
Yes.
Bob washes his hands.
Be like Bob, yeah.
Be like Bob.
Right.
Don't be dirty.
Right.
That will probably cut back a lot of COVID, but it's true though.
So is all this COVID stuff now hurting people that have injuries and
I think
diseases and conditions that normally would be coming to you, but because of COVID, maybe not?
maybe not just us, but just people who have chronic diseases and chronic disease states. I mean, I don't think people feel comfortable still going to the doctor.
Right. Yeah, I hate going to the doctor. I would rather go to the dentist and have him pull my teeth than go to the doctor, even just for a physical. I would, and it's just my thing. Like I just hate doctors,
Right.
and I know most of them mean well, but I think some of them don't.
And you know what
I don't trust them.
Right. And just the whole loneliness of all of it. I mean, people have been so isolated.
Right.
And a lot of times when people go to the doctor, they need someone with them. They need someone advocating for them. And now you can't bring someone with you.
Right.
I mean, I have family members right now that are some of them not in the best medical state, and they're navigating this whole process by themselves. There's only so much you can hear in a doctor's appointment, right? And you need someone kind of standing with you, or maybe even maybe two family members, helping you navigating that whole process with you.
Right. So are you partnering with other businesses or with municipalities or with maybe even nonprofits to try and get these vaccines out?
So we are working with some municipalities right now. I don't know exactly. We're working with the city of Haverhill. We might be doing something with the city of Methuen if they need help. I mean, basically, it's like if you need help, we'll try to help you as much as we can. My providers are pretty passionate about trying to help I'm passionate about trying to help the community. All this testing is great, but we really need to get to the root of the problem and to try to basically stop COVID at where it starts.
Right. Well, Lisa, I love that you are willing to come on the show and tell people about what's going on with all of this stuff. Has it taken a personal toll on you? If you don't mind me asking, has it taken a personal toll on you? Because as the owner of AFC, you're not dealing with patients every day, but you have to manage all of it. Like you have to manage everything. Oops.
Well, I mean, we did take.
I was raised by Italian, so I do this when I talk.
We did take on a partner, which has, of course, helped. Which is actually great because now we have a lot more resources. So that's been, of course, very helpful. But I think there's a lot of things that change, and things change, with this every week. Mm-hmm. And trying to get the message out there, just educating the community of, yes, last week, tests were free.
Right.
This week, we got to charge you,
right.
And that is just, that's awful.
Yeah.
Yeah.
I got a press release, and I didn't read it. I skimmed it from State Senator Diana Dzogwe, who hopefully will be here in the next couple of weeks, excoriating the governor for not having an effective and efficient testing vaccine rollout to I don't know, what word would we use, Ben? Underserved communities. I'm just going to say minority communities. I don't know, whatever the politically correct term is these days. And we hear a lot from the new president about, and it makes me crazy, but in this case, he may have a point, about the fact that Blacks and Latinos and minorities are much more highly affected by COVID.
Of course.
They get sicker than white people and people of other nationalities. They get sicker longer. And the death rate is higher. So Diana, I think, is looking for the governor to say, to reveal how it is we're going to roll this out to underprivileged communities, minority communities. And from what I read, I mean, I just went through it, and the phrase in the back of my head that kept sticking out was shit show. Like, it seems as though Diana is basically saying that the governor's rolling this out, but he's not doing it right, and there's no actual plan.
Well, I don't know if that's the governor's fault, or maybe there's a delay in the manufacturing of the vaccines, and maybe that I think there are multiple factors here, and of course we like to put the blame on someone. I don't have all the facts here.
Yeah, see, I don't really care who's to blame. I just want it done.
Right. So I know a lot of people want, I want the vaccine. I want the vaccine. I want the vaccine. Well, the vaccine has to come from, the pharma companies.
Right.
And how do we get it, right? The biggest thing is the refrigeration for the Pfizer vaccine. Who has the refrigerators? I don't.
Right.
Okay. I would love to.
And it's not just refrigerated. It's got to be like
sub-zero, whatever.
2 degrees below zero or something.
And that was
like
the first one to come out.
Right.
So we can, we'd love it, but I mean, who can actually, who can store it?
Right.
Someone said to me, yeah, you can get the Pfizer vaccine and put it on dry ice. I'm like, no.
So has it taken a personal toll on you because you've got to run everything? And
like I said, I don't do nearly as much as I used to do because that we have
scaling back a little bit.
Scaling back.
You have to though. You have to. Like I know from running my own business. When I started this business, it was me and my girlfriend. She was a lawyer, so she handled the business part of the paper, and I did the journalism, and she did the selling of the ads and the invoicing and all that stuff. And then when we broke up, I had to do both. And it was tough for the first 4 or 5 years because I wasn't really a business guy. I was the journalism guy. I was the guy that wanted to go to the meetings, write the story, take the pictures, and do that stuff. And I had to do all of it. And then when COVID hit, we had to redo our whole business model because we went obviously 3 months with no revenue. And I started thinking about what you have to deal with because I'm a small business compared to you. You guys are much, much bigger. And it's a much different kind of business. And I thought, geez, Lisa's got to be working like 18-hour days.
So no, so we did take on a partner. We did have someone actually running the operation for a while, and then I actually did take on a partner because, like, I have a lot of kids, as you know, right, and
great mom.
Try, but yeah, you need support, and especially with COVID, you need a lot of resources and you need a lot of staff.
Mm-hmm.
And that is, of course, staffing has been, of course, complicated, and that's the biggest thing. Like, at one point in time, we were getting as many as like 1,000 calls a day. So people will call me like, "How come no one's answering the phones?" I'm like,
"Because 1,000 people are calling at once."
1,000 people are calling a day, and it's a really hard job. I don't think people really understand how hard it is, especially when the staff was working outside all day long.
Right.
It was horrible. I felt bad for them. Yeah.
Just having to work outside during the summer.
All day.
So I remember going by to drop papers off.
Yeah.
Sometime
it was like 90
July.
Degrees. They're all working outside.
Oh my God, it was just so horrible. Everybody was just so wet and sweaty, and it was just.
I know.
It was just terrible.
I'm sorry.
I felt so bad for all of the people who work for you.
I know. And Methuen is a lot more forgiving than North Andover.
Yeah, North Andover is a much more upscale community, so they demand more, I've noticed.
Lisa, last Tuesday, my cousin was exposed to COVID, like, right? Do we qualify for a test?
Right.
I'll stop talking right now.
Do you see an end to this? Do you see this ebbing a little bit?
I think now we will definitely see cases definitely drop down, especially with the change of presidents.
Mm-hmm.
I think we're going to see a lot less COVID. With the vaccine, getting out there, they did. First responders, of course, were vaccinated. Healthcare workers were vaccinated, and I think people are really focused on the vaccine. Although it's not really. It's kind of here, but not really there. But yeah, I think people. I'm hoping. I'm hopeful that way.
I know a lot of people didn't like Donald Trump. Right, the country was divided down the middle.
Wait a minute. 50%. Like there was. It was definitely hugely divided.
Yeah, it was like almost right down the middle. But the reason I brought that up is because whether you liked Donald Trump or you didn't. It is absolutely astounding that in under a year, we were able to get a vaccine, test a vaccine, and have it available for the public. Whereas prior to COVID, we learned a lot during the 4 years of Donald Trump. We learned a lot about what we thought was real and what turns out not to be real. We were told on every other vaccine, it's going to take 5 years, it's going to take 7 years, we have to do double testing and all this. Then this happened. It became a priority. The government made it a priority in the Trump administration. They made it a priority. And while CNN and some of us, even myself, are complaining about not having the vaccines rolled out smoothly or not having enough or not having it working well, the fact that we even have one in under a year, I think, is absolutely astonishing. I mean, this means they could have done this all along with other stuff, with the flu, with other things. And that the big corporations just didn't want that, right?
It's not that people were held accountable.
people were held accountable?
They were held accountable.
What do you mean?
Like, I mean, this was a priority.
Right.
You know, this was a priority. All of it was a priority, and people were, you know, very hyper-focused on getting this done.
But when, like, the flu comes out, or pneumonia, or a new strain of the flu, it seems like if we could do this for COVID, then why can't this be the standard? Like, why when this is over, are we going to have to go back to 5 years for a vaccine for the next thing that comes along? It seems as though, like, the veil has been lifted. You know, the curtain's been lifted, and we see the guy behind the curtain. And that, like, you know, all these things that we thought were real, like 5 to 7 years for a vaccine for the flu or for pneumonia or for whatever, suddenly it turns out we didn't really need to do that. Like, suddenly it turns out that, like, we could have done that in a year if we were really committed to doing that. If people were, I'll just use the word committed again, if people were just committed and made it a priority. And so I'm hoping now once this is over, we don't go back. I'm hoping now once this is over, something else happens. Make it a priority. Get everybody vaccinated. Get the vaccine done. Do it in a year. We know that now that you can do it because nobody even knew what a COVID was when this started. Like, I can't even imagine what that process was of trying to invent a vaccine, right? I mean, kudos to all the healthcare professionals that worked on that for the year that they did. Right?
Very impressive.
All right. Well, thanks for coming. I appreciate you. Appreciate you being on the show. If anybody has any questions for Lisa Williams here on Paying Attention, we'll hang on for a couple of minutes. Geraldine said on Facebook says, "How tough is it with no long-term data? Like, we're all flying blind with this. We have no idea what's going to happen next." She didn't say all of that. She just said the first part.
Okay. To be honest with you, I don't know. I mean, there's a significant amount of data out there. There's how many Johnson & Johnson, Moderna. We have 4 different companies that actually have their vaccines will be out there.
Is one better than the other?
I don't think so.
No, they're all kind of the same.
I mean, in terms of refrigeration and storage, but
yeah.
I personally,
are they different? Are the vaccines? Is there something different about each? I mean, I imagine if each company invents their own vaccine, they would have to be different.
And there's not like a huge, like this one is, you know, this 2% more effective than that one. I mean, there's not like a huge difference between them. And I'm going to take the next one that's available to me.
Right. I'm frightened to take it because I haven't had COVID and I don't want to get sick. And I've had friends tell me that they're getting sick from it. And
but that's your body's natural reaction to the vaccine.
Yeah, I don't do well with sick.
Right.
I mean, at all. So, I mean, I have a tough enough day as it is physically that if I get sick, it's just going to debilitate me. So I'm afraid. So what do you say to people like me who are afraid to get the vaccine?
Well, there's going to be a lot of people that are going to be afraid of it. And, you know, I don't know. I mean, it comes down to, this is what I'm telling people, contact your healthcare provider, because I don't want to be the one to persuade you to get the vaccine and then something happens. That's a liability.
Who shouldn't take the vaccine? Is there a population out there that should not take the vaccine right now?
At the end of the day, it's only your healthcare provider, your doctor that will tell you whether or not, because there are some people out there that shouldn't take it, and it's only your doctor that's going to know that.
All right. So
that knows your previous medical history.
Right. So it's not like a specific group of like the elderly or people that have had cancer or people that have had.
No, I mean, it hasn't been tested on children, pediatrics, but that doesn't mean it's not indicated for children.
So we don't even know if it works on kids, but most kids aren't getting it anyway, right? And if they get it, they're not getting sick.
It's not indicated. They're not going to vaccinate, you know, because it hasn't been indicated in that population. And they usually say, you know, sometimes if people have allergy to eggs or
allergy to eggs.
Yeah, but certain allergies.
All right, very good. Lisa Williams from AFC Urgent Care. We always appreciate having you here.
Thank you, Tom.
I love having you here. I love having any business owner in that is helping the community. I think those are the people that we should spend our money with. I think those are the people that we should do anything that we can for. And if there's anything that we can do to help AFC get the word out, happy to do it, whether it's writing a story, whether it's posting stuff online. I know a couple times you've called me and said, hey, we just posted this thing online. Can you just share it out for me?
Sometimes we do like mass testing, but we haven't done that in a while. And when I actually have final word on exactly what's happening with the vaccine, I'll definitely let you know.
Oh, great. And how is Tom Savinelli Williams DeLacy doing? This is how I get her in trouble with the husband. That's how I steal her away. He gets mad at her for what I say, and then I get to scoop her up afterwards.
He really has nothing to do with it.
No, he doesn't. And he's such a nice guy. I remember he spoke at a Methuen meeting one day about insurance stuff. And I don't know anything about insurance stuff, so a lot of it went over my head. But he just seemed like such a nice guy that he was trying to help the community out.
Yes, he is, and this is not really his thing.
No.
It's really
No, he didn't want to be doing AFC Urgent Care stuff. No.
It's not really.
Well, it goes to show how much he loves you, right? He's willing to go in and do that.
Yeah.
We want to thank our sponsors, McLennan Real Estate. We love Sam and Matt and Janet and all that they do for TMF, for the Family Dinner for the Homeless, and a whole bunch of other things in the community. AFC Urgent Care. We have Lisa Williams here today. Marsan and Son Construction. Borelli's Deli. I'm going to be grabbing my deli meats on the way home. That's like my new thing on Thursdays. It used to be I'd leave here and go to Thwaites and get my steak and my chicken. And now I leave here and I go to Borelli's Deli and I get my deli meats now. Because I mean, the best in the Merrimack Valley, no question.
One-stop shop.
One-stop shop. Clear Path for Veterans, New England. A shout out to Jason Gilbert. His mom passed away a couple of weeks ago, and that's why he hasn't been here. He's usually here in this spot. This is usually the week that he comes in with Clear Path for Veterans, New England. And I think they're staying with us. Their contract ran out for this month, but I think they're staying because I was talking to Randy, and he said that they've had several veterans reach out to them as the result of this show that needed services and got services. So even if it's only one veteran, I'm happy, but I hear that it's a bunch of veterans have done that. So we definitely want to have them come back in and talk about rescue dog, not rescue dogs. What do they call them? Service dogs, and what it is that we can do to help the homeless. Want to also thank Andover Optical. I think this is their last week, but we're trying to get them in again. And even if they don't come in with us for February, this is our last one before February 1st, I think, right? So even if they don't come back in for February, go there anyway. Go to Andover Optical. Tell them you need new glasses, new reading glasses. You need an eye test, and thank them for sponsoring the Paying Attention podcast and the Valley Patriot. Because I promise you, they're hearing from the haters. There's a whole bunch of people out there yelling and screaming, trying to boycott and all this other stuff because they just can't stand the fact that someone has an opinion that's different from theirs. And they cause all kinds of trouble when they do, and it's usually politicians. So I was a little surprised to see Methuen City Councilors calling for the boycott of Methuen businesses, but there it is. It was right there. So please go into Andover Optical and just tell them, even if you just need new contact lenses or some new cleaning solution for your contact lenses, and go and just thank them for sticking with the Valley Patriot and with the Paying Attention podcast. We definitely appreciate those. And I want to give a free plug to FH Can Associates. I love the Can family, man. They are such great people. I was on a Zoom call with them with the Lawrence Exchange. We're trying to do a partnership with the Lawrence Exchange to try and raise some money for their causes. When Lisa's here, I just get flustered. I can't think right.
Stop it.
But they've got a bunch of things that they're trying to raise money for, and we're going to try and partner with them to try and help them raise money. So at some point, I'm hoping to have some people in here from the Lawrence Exchange, and maybe we even have Frank Can come in and talk about some of the stuff that he does for the community. I'm always amazed when I meet someone like Lisa, I meet a guy like Frank Can, and I find out from the people who work for them how much they're doing for the community. Because there are other places, like I don't want to mention like a certain bank in the area that sends me a press release every flipping day to say, look, we just donated $500 to the Boy Scouts. Look, we just donated $10 to the Girl Scouts. Can you write a free story about us? And it's like, no, that's called an advertisement, right? We actually charge people for that. Please don't send me these press releases anymore. But then there are other businesses like Lisa and like the Fitzgeralds at Man Orchards and like FH and Frank Can and Sherry Can at FH Can Associates, who go out and do an awful lot of things for the community and don't want to be recognized. I don't get press releases from Lisa or the Fitzgeralds or from Don Smirglio or from any of these people saying, hey, we just did something good. Can you write about it, please? So I'm always trying to find a way to promote those people because those are it's not your mayors and your city councilors and your school committee members and your state reps that are making a difference in your community. Trust me when I tell you, it's It's the small business owners that are actually pitching in and helping out and doing stuff above and beyond running their own business to help the community. So I want to thank them, and I want to thank you, Lisa, because we love you here on the show, and you're always welcome.
Thank you.
Lunch?
Sure. Yeah.
The best. I love my lunches with Lisa. You know why? Because I check in. I always go on Facebook and I check in that I'm with Lisa Savinelli Williams, and every woman in my life is like, "Who's that? I want to know who that is." So it makes them all crazy, which I love. All right, next week we're going to try to have Clear Path for Veterans New England here in the show. If we can't get them in, because I don't know if Jason's, I don't know if he's back to work yet. I know he took some time off, and our prayers and our thoughts go out to him. It's tough to lose a mom. I know that for sure. We're going to try and have him back. We're also going to try and have on State Representative Linda Campbell. And we're hoping at the end of next month we're going to try and get Diana DeZoglio on. Melvin Taylor, it sounds like he's saying, we got to go home. So go home already.
The views and opinions expressed by the hosts, guests, or callers of this program do not necessarily reflect the opinions of the Studio 21 Podcast Cafe, the United Podcast Network, its partners, or affiliates.